Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armin Budish, and from the Board of Health we have Health Commissioner Terry Allen, Incoming Health Commissioner Dr. Rod Harris, Director of Epidemiology, Surveillance, and Informatics Jana Rush, and Co-Director of Prevention and Wellness Ramona Brazil. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Good afternoon, everybody. It's been a while since we've been with you, and I guess you could say that's a good thing because we're in good shape here in Cuyahoga County. Our COVID positivity numbers are nearly the lowest they've been in a long, long time. This is something to celebrate after the last 2 years, but we're still being vigilant and encouraging everyone to stay safe and to get vaccinated. I'm proud of the hard work Cuyahoga County residents have put in to lessen the spread and make smart choices. I truly believe that a lot of the reason that we've been able to crawl out of this terrible crisis is because of the person joining me here today, Terry Allen. Brian Tracy said, "The true test of leadership is how well you function in a crisis." And there's a popular English proverb that's often linked to Winston Churchill. Cometh the hour, cometh the man. It's the idea that the right leader will stand up during times of crisis. Well, we've been going through a terribly tough crisis, the COVID-19 pandemic. When I speak with county leaders from across the state and the country, Cuyahoga County is recognized as one of the counties that has come through it all the best. And that's thanks in very large part to our Board of Health Commissioner, Terry Allen. Terry was planning to retire 2 years ago in 2020 after 31 years with the Board of Health. But cometh the hour of the pandemic, cometh the man, Terry Allen. He decided he couldn't leave during the worst health crisis in memory, so his retirement plan became history. Commissioner Allen was the right leader at the right time. His background provided the training needed for this crisis. He earned his Bachelor of Science degree in biology from Bowling Green and his Master of Public Health degree from the University of Hawaii. We're lucky that he didn't let the allure of beautiful sandy Hawaiian beaches capture him. He served 33 years with the Cuyahoga County Board of Health, 18 years as its commissioner. His leadership has been widely recognized, having been elected by his peers as the president of both the Association of Ohio Health Commissioners and the National Association of County and City Health Officials. He had previously brought the county through multiple health crises, including swine flu, West Nile virus, Legionnaire's disease, SARS, and meningitis. Those prepared him well, but this was a crisis like no other. First with testing and then with vaccinations, Terry understood that this unique crisis called for equitable solutions. Not equal, but equitable. And Terry knew the difference. Let's take vaccinations, for example. Vaccines were being made available equally throughout the county, primarily through drugstores. But using an extensive drugstore distribution program did not and would not bring equitable results. Some neighborhoods had fewer drugstores, and some people had less ability to get to drugstores. So Terry arranged for the Board of Health, the county, the Metro Health, and other partners to engage in an intensive outreach program in underserved areas in order to try to reach an equitable result. During a crisis, communication is critical. Amy Edmondson wrote, "Transparency is job one for leaders in a crisis. Be clear what you know, what you don't know, and what you're doing to learn more." McKinsey & Company wrote that thoughtful, frequent communication helps inform and reassure the public. I was proud to join Terry Allen in biweekly media briefings and sometimes more frequent than that. We agreed on the importance of keeping all of you informed on both good news and bad news. Commissioner Allen even brought members of his staff to provide detailed analysis of the state of the pandemic, and he endured my occasional attempts at humor, even singing. This week will be Commissioner Allen's last of our regular media briefings. He's reset his retirement, and his final day as health commissioner will be April 29th. I tried to explain that the COVID crisis is still not over, but I couldn't convince him that he had to stay on longer. I really don't understand his desire to retire. This is such an easy job that he has. But seriously, for the last 2 years, he's worked 7 days a week, almost 24 hours a day. And I know because I've talked to him on the weekends, late at nights, and early in the mornings. I saw him and his staff working 12-hour weekend days, providing vaccines at the Word Church in Warrensville and at the Salvation Army in East Cleveland and at many other sites. Ronald Reagan once said, "It's true, hard work never killed anybody, but I figure why take the chance?" Well, Terry Allen took the chance, and he survived. But I guess Terry figured he could only push his luck for so long. So, Terry, we're glad you stayed to get us through this crisis, and I'm especially glad that you survived. In a minute, you'll get to meet his replacement, Dr. Rod Harris. Like Terry Allen, Dr. Harris comes in with an outstanding background, with one exception. He comes from Pittsburgh. Thank you. It's your turn, Terry.
Thank you very much, Executive Budish. That was too kind. You've been an incredibly wonderful public health advocate. As I've said, you have an honorary MPH for the way that you've embraced the work and understood the details and the nuances of the pandemic and often the twists and turns that occurred over the course of the last 2 years. Every time we needed you, every time we needed your staff, they were there, always there, particularly when the going was really tough. And for that, I will be eternally grateful. You were very kind in your words. And I have to tell you that I've only had the honor of working to lead the finest group of public health professionals in the state. Some of them you'll hear from today. Dr. Harris comes from, he's a Clevelander. You'll hear about that. Now he's coming back to Cleveland. He originally grew up here in Cleveland, and he's happy to be home, and we'll talk about that in a moment. And he's assured us, of course, that he is not a Steelers fan, which was part of the interview process. So it was the first question we asked. But people like Ramona Brazil, people like Jana Rush, Rick Novickis, Becky Burke, Judy Wershing, Kevin through all the briefings. So many people, Nichelle Shaw, Martha Halko, Wallace Chambers, John Soboleski. Many, many people have been.
Don't forget Dr. Gullett.
Yes, that was, thank you very much. Dr. Gullett was incredibly integral to the process. And it was a challenge. It has been a challenge. And people kept coming back. Thank you for that reminder, of course. And we now have a new medical director, Dr. Prakash Ganesh, who will be joining us in a future briefings. He's a disciple of Dr. Gullett's, and we're glad to welcome him. So just again, Armin, very kind words, and it has been an honor to serve here with the community. And I've got a few sort of overview points and a couple memories I want to share, if I can, here before introducing Dr. Harris. So our collective response to the pandemic over the last 2 years has been a testament to the strength and perseverance of our staff and our partners. The numbers have been staggering. To date, over 12,600 have been hospitalized and more than 3,750 people have lost their lives in Cuyahoga County. During that time, the Cuyahoga County Board of Health has managed more than 187,800 isolations, and 3 times as many people have been quarantined during that period of time. We've also provided 1,600 deliveries of resources like food and other essential supplies, cleaning supplies, thermometers, so that people can safely isolate and quarantine. Over 60,000 calls from the public have been answered at our call center on a broad range of COVID-related topics. And to date, the Cuyahoga County Board of Health has provided 36,650 vaccinations with an additional 23,000 boosters administered, including a sustained focus, as Executive Budish pointed out, providing equitable vaccine access in our most vulnerable neighborhoods. The North Star of public health has been equity, and that was important for us to focus in, and we continue to do that today. More than 1,550 homebound vaccinations have also been provided and administered in coordination with our community partners. and mountains of data have been analyzed and made available to the public for decision making. Over 100 of these briefings have also taken place to keep our community informed, and we've again appreciated that partnership with Executive Budish and his team to assure that we were ready. We had all the details on the ground and had the supplies, equipment, and finances that we needed to make it work. Countless lives have been saved in the process, and we have avoided the worst. We all sincerely hope that the acute phase of the pandemic is now in the rear view mirror. And I'm proud to have been part of our community response and to have worked alongside our very dedicated staff at the Board of Health that kept on pushing forward, come what may. And when we know our community needed us the very most. So there have been many milestones over the last 3 decades, and I'd like to just share a few. We know that old and improperly functioning sewage systems can discharge untreated sewage into our streams and tributaries that eventually ends up in the lake, the drinking water source for 11 million people in the region. Back in the 90s, there were over 17,000 home septic systems in the county, believe it or not. Now there are about 8,000. We got there by working with our municipal partners over the last 3 decades to reduce illicit discharges through sampling of outfalls and facilitation of sewage treatment system repair and replacement, working with the Public Works Department under the county executive, and connecting to municipal sewer lines. Consequently, our water quality is significantly better than it was at that time. In 2005, the Board of Health actively advocated for the passage of the Ohio Smoke-Free Workplaces Act to support a statewide grassroots referendum which banned smoking in bars, restaurants, bingo halls, bowling alleys, and all places of work in indoor locations. And that happened in 2006. We worked with public health advocates all over the state that joined in this monumental effort. After a pitched battle with the tobacco industry, the referendum passed, with 58% of Ohioans voting to support smoke-free indoor spaces. The near-term net result was an impressive 28% drop in chief emergency department complaints for heart attacks post-ban. Now, support is virtually universal. We also know that 95% of adult smokers start before age 21. And so more recently, our local Tobacco 21 efforts in coordination with other counties led to a statewide prohibition of the sale of tobacco products to kids under age 21. We also know that childhood lead poisoning is preventable environmental illness that adversely impacts cognition, retention, and IQ, consequently diminishing lifelong opportunities for the next generation here in our community. The Cuyahoga County Board of Health's long effort to address childhood lead hazards in homes, in coordination with community development agencies, land bank demolition, and renovation projects, has reduced childhood lead poisoning by 75% since the mid-90s. And we work very closely with the County Department of Development since that time under the executive's office. Impressive progress has been made, and there's still important work ahead to protect our most vulnerable children and families from preventable environmental hazards. We're excited that Executive Budish and the County Council are considering an important investment in the American Rescue Plan funds to help advance this work. The Cuyahoga County Board of Health has also been an essential partner in addressing racial disparity gaps in infant mortality in Cuyahoga County for many years. Staff conduct infant mortality reviews to identify needs and gaps in service, analyze critical data to illuminate inequities, and conduct newborn home visits in the first 2 weeks of life. They also work to identify novel community-based strategies to close the gap. We know, unfortunately, for many decades that progress has been slow. We know that non-Hispanic Black infants have been over 3 times more likely to die in the first year of life than their white counterparts. Recent analysis is showing some promise that some progress is being made, and we're excited about that. And this work continues as a labor of love for our staff focused on working with the community to assure that every child sees their first birthday and beyond. Over the last decade, we've prioritized expanding our collaboration with hospitals, social service organizations, nonprofits, and grassroots groups to improve the health status of our under-resourced communities, coordinated health assessment and community health improvement initiatives, expanded resources focused on the social determinants of health, targeted programming, and community advocacy have all been significant components of the work and will be integrally important parts of the future work of public health. These are just a few examples of the incredible work by the public health professionals at the Cuyahoga County Board of Health. And I'm very proud to be working with this passionate group. They're a group of incredibly dedicated public health professionals through and through. For me, it's been a singular privilege to serve. And after 33 years as the county executive noted and 18 as the health commissioner, it's time for me to pass the torch. And I'm happy to report that a Clevelander is returning home to serve as the next Cuyahoga County Health Commissioner. Dr. Roderick Harris has over 25 years of experience in public health. Prior to joining the board here, Dr. Harris was deputy director at the Allegheny County Health Department in Pittsburgh, serving a population of 1.2 million. There, he oversaw the operations of the Bureau of Community Health Promotion and Disease Prevention since 2014. And during his tenure there as a member of the senior leadership team, the department became accredited through the Public Health Accreditation Board, a voluntary designation achieved by state, tribal, local, and territorial health departments nationwide. And I'm proud to say the Cuyahoga County Board of Health has also achieved that designation. His previous professional experiences include serving as director of Children and Family Health Division at Sedgwick County Health Department in Wichita, Kansas, and founding director of their Center for Health Equity. He also has experience in private industry as a health services manager at Eastman Kodak. Dr. Harris completed fellowships at the U.S. Centers for Disease Control as well as the American Evaluation Association. And he earned a doctorate of public health degree from the University of Pittsburgh's Graduate School of Public Health, a Master's of Science in Public Health Services Administration from Meharry Medical College, and a Bachelor of Science in Environmental Health from Ohio University. In the early days of his career, Rod began his public health work right here at the Cuyahoga County Board of Health, and we're very glad to welcome him home and back from Pittsburgh. It's my great pleasure to introduce the new Health Commissioner of the Cuyahoga County Board of Health, Dr. Rod Harris.
Hello. Thank you for having me on the call today. My name is Rod Harris, as Terry mentioned, and I'm glad to be back in Cleveland at the Cuyahoga County Board of Health. This is a wonderful team, and I would like to first say thank you to County Exec and Terry for your leadership in this crisis and this pandemic. My family still lives in Cleveland, and they're residents of the county throughout East and West Side. And so I'm glad to know that they were in very good hands with your leadership, and I'm happy to be a part of the team. As Terry mentioned, I worked all over the country, and primarily my main focus has been the pandemic in Pittsburgh, Pennsylvania, and very similar to Cleveland, we've had our challenges, and I'm looking forward to bringing those experiences here to the Cuyahoga County Board of Health and to the residents of Cuyahoga County as well. So thank you very much for having me, and I look forward to joining you in the future debriefs and the briefings as we move forward. And we have Jana Rush, who's going to be up next. She will share some highlights about the data regarding the pandemic and also the BA2 variant and what we are seeing as far as our trends. And so up next, we'll have Jana Rush.
Okay. All right. Good afternoon. So I'll be giving an update on where we are currently with our numbers and our data in relation to the pandemic. So a month ago today, we began updating the way we monitor COVID-19 and its impact on our community. The widespread availability of vaccines, testing, advance in treatments, and increasing levels of immunity in the population through vaccination or previous infection have moved the COVID-19 pandemic to a new phase. Although we can't prevent all cases of COVID-19, we can continue to limit the spread and protect those who are at most risk of severe illness and disease. As a result, we will continue to monitor cases, hospitalizations, and deaths in our community, but we will be paying closer attention to new variants and how they spread within the population, as well as tracking clusters and outbreaks occurring within congregate settings such as nursing homes, daycares, schools, jails, and shelters in the coming months. Currently, according to the CDC and ODH data trackers, Cuyahoga County has a low level of community transmission of COVID-19. For our reported cases, we're currently averaging 50 cases per day, which is our jurisdiction's baseline based on levels observed earlier on in the pandemic, beginning in June of 2020, 3 months into the pandemic. We have also remained stable at this rate since mid-February following the Omicron surge. Our case rate is 56 cases per 100,000 residents, which is about 36.5% higher than the state of Ohio's rate currently. And nearly 188,000 cases have been reported to date. For hospitalizations, we are seeing less than 2% of inpatient beds are in use by patients with confirmed COVID-19. And over the past 7 days, 31 new hospitalizations were reported from those visiting visiting hospitals or have been hospitalized. Through the beginning of March, approximately 21 people were reporting to emergency departments for COVID-like symptoms. And to date, we have had over 7,500 hospital admissions reported to date in the county jurisdiction. In relation to deaths, sadly, COVID has claimed the lives of over 3,700 people in our county as a whole. However, it is encouraging that over the past 3 weeks, no deaths have been reported in relation to COVID-19. In relation to testing, our positivity rates have been decreasing for over 10 consecutive weeks, with a high of over 35% during the Omicron surge. And currently, our countywide rate is at 2%, with the volume of tests remaining stable over the past 7 weeks, with about 30,000 tests being ran each week. For our vaccinations, 62% of the community has completed their first dose series of the vaccine, and 35% have received a booster dose. We saw peaks of people getting vaccinated during the first and second quarters of 2021, and we saw a peak during the fourth quarter of 2021 for people receiving booster doses. Since that time, our uptake has decreased, and those aged 5 to 11 still represent the lowest proportion of those vaccinated within the population at 28%. So a few new things that I want to share is that our dashboard updates will now move in alignment with the Ohio Department of Health. And so our dashboard will now be updated on Fridays each week, once a week by 2 p.m. We also have a new data tool on our website, and it is our COVID vaccination status by zip code. And so you're able to now see the vaccination rates throughout Cuyahoga County by zip code. And so you're able to have an interactive map in order to view that information in real time weekly. Something else that's new is that we're currently tracking about 164 cluster investigations that we're conducting. About 64% of those are occurring within our long-term care setting. This is down nearly half in comparison to where we were at the height of the Omicron surge. Additionally, resident and staff cases are down over 90% from the last quarter of 2021. And then lastly, I want to mention about the Omicron BA2 subvariant. This now makes up 85% of new infections that are occurring locally as well as nationally. And then a few facts that I want to share about the BA2 variant. It is now the dominant variant circulating here throughout the US, as well as being a variant of concern that the World Health Organization is following. It is more transmissible than BA1. There's no reported difference in the severity of BA1, and that has been verified. So those studies are ongoing. Natural immunity and vaccination are protective, and being boosted is critical for maximum protection. And then I'll end in closing is that we should remain on alert as the pandemic continues to unfold. Children and seniors still remain vulnerable. We have many tools to protect ourselves, and we should remain ready to use them as the situation changes here locally and nationally. So now I'll turn it over to our co-director for prevention and wellness, Ramona Brazil, to cover information in relation to vaccines in our clinics. Thank you.
Hi, everyone. So as Janice said, we're going to continue a lot of our activities, including vaccinations in the community. We continue to partner with schools and churches and community organizations, focusing in areas with lower vaccination rates to bring vaccines into the community for adults and children. While we are very happy to see lower case rates, COVID does still pose a risk to those who are not vaccinated or who are not up to date on their vaccinations. And when we talk about up to date, we mean that you are receiving your COVID doses when they are due. So if you haven't been vaccinated yet, you still need to get vaccinated. We still are vaccinating people with their first doses to get second doses, as well as when it's time to get a booster, which would be about 5 months after you take a first or second dose. And then now we also know that the second booster dose has been approved. So for second booster doses, those are for folks who are 50 years old and older, and it's been at least 4 months since they had their last booster dose. The only vaccinations that can be used for COVID for that second booster dose are Moderna or Pfizer. And making sure that you get that booster dose as close to when it is due will help to provide the most protection to keep you safe from severe disease, hospitalization, and death. So the vaccine continues to be widely available, and you can access and make appointments for our clinics at the gettheshot.coronavirus.ohio.gov website. Now I'll turn it over to Devin for questions.
Thank you very much for all your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So does anyone have a question?
Hello, Sarah Schuckman with WKYC here. Can you hear me?
Yes, thank you. Go ahead, Sarah.
Well, first off, I'd just like to say congratulations to Terry Allen and thank you for all of the work he's put in and for being so open with the media. We really appreciate all the communication and wish him well in this new chapter. I know we just went over some of the data, but we are watching increases in cases in the Northeast. We saw what Philadelphia did yesterday by reinstating their mask mandate as of next week. There's been some reporting that's been critical of Ohio's decision to report data weekly instead of daily, saying that will make it more difficult to notice an upward trend. So first, can you talk about what indicators you're watching to assure us that we are not on the verge of this uptick that's being seen in other places? And second, how can you assure people in Cuyahoga County, even though so many people are moving on and are ready to, but the Board of Health is being as vigilant as ever?
Hi, so I just want to make sure that I clarify the question as far as the data reporting. Was the question related to the frequency of how we're tracking data through our dashboards?
Yeah, I think, or just what other indicators you are looking at that assure you that we're in a good place. I know there has been some uptick in the wastewater data locally. Are there any other early indicators you all are watching other than the cases and hospitalization?
Yeah, so we do pay attention to the wastewater surveillance data. So that is an early indication of disease transmission that could be occurring 2 to 4 weeks after we see any spikes or increases in that data. Another thing that we pay attention to is the inpatient hospital bed usage within our hospitals. And so typically, when we see any type of uptick in relation to that, we're monitoring those outcomes closely. And now that we have different types of mitigation efforts that we've used throughout the pandemic, now we have a good proportion or subset of the population that has some protection or immunity. And so now with that, we're paying more closer attention to looking at clusters and outbreaks that may be occurring within the community. So if we see pockets of cases, and we're tracking that on a day-to-day basis to see where those are occurring, and so that we can implement methods pretty quickly to ensure that we are able to limit the spread further after tracking those clusters and outbreaks. So those are other indicators that we're paying attention to. Our positivity rate is also something that we watch closely. So as tests are ran weekly, we're looking at if that rate increases over time. And so we're able to see those trends and track those as well.
Thank you. So to make sure I have this clear, you guys are seeing some of this data daily. It's just being reported publicly on a weekly basis. And so you were able to respond quickly.
Right. So yes, we have access and track the data day to day. We're able to see these numbers. It's just that, yes, what's reported on the dashboard is updated on a weekly basis.
Thank you.
You're welcome.
All right, any other questions? Okay, thank you very much. That concludes this week's briefing. Thank you so much for joining us. We wish Terry Allen well. Have a great week. Thank you very much.
Okay. Thank you. Bye. Okay. I don't know, Kevin, how are you doing?